What is a better question to ask yourself? 1. Why am I always depressed? 2. How can I be happy? Put your answer down in the comment section below. Now let's get started. If you're being prescribed fluoxetine, do not be afraid to take it, because you and your doctor would have weighed out that the benefit of taking it exceeds the risk of not taking it. Remember, if you are experiencing depression or anxiety, you are not alone. Many people experience the same thing, and you do not have to be in this mental state. Just like blood pressure and diabetes, they are conditions that can be treated. Talk to your doctor about it today. Many of my patients have successfully turned their life around for the better and feel happy again. Hi, it's your pharmacist Sun-Ki here. Fluoxetine's common brand name, Prozac, is a selective serotonin reuptake inhibitor, SSRI, used to treat depression, obsessive-compulsive disorder, premenstrual dysphoric disorder, some eating disorders, and panic attacks. If you're interested in knowing more about how it works in the brain, I have made an animation video about sertraline, which is also SSRI, which works similar to fluoxetine. I'll put the link down below for you. Fluoxetine is strictly a doctor's prescription medicine. Do not self-prescribe. This is not an advertisement. These information are of general nature only. It does not replace the need for you to get advice from your local doctor and pharmacist. Before you start taking fluoxetine, tell your doctor if you have any allergies, if you have any medical conditions. This includes diabetes, kidney or liver problems, glaucoma, history of seizures, any bleeding disorders, or a tendency to bleed more than usual. Tell your doctor if you're pregnant, plan to become pregnant, breastfeeding, or plan to breastfeed. Do not take fluoxetine if you are taking another medicine for depression called monoamine oxidase inhibitor, MAOI, or have been taking a MAOI within the last 14 days. Usually, if you are swapping from a different class of antidepressant, there is a washout period. Washout period means that you need to wait for the previous antidepressant to clear out from your body before starting a new antidepressant. Every antidepressant has different washout period. Your doctor will instruct you what the washout period is. Drug interaction. Fluoxetine can interact with many other medications, such as St. John's wort, a herbal remedy that is used to treat depression. So let your doctor know all the medication that you are on. This includes anything that you buy without a script from the supermarket. Now hang in there. There are more important information coming. If you have gotten value out of this video, please hit the like button down below, consider subscribing, and turn on your notification button. How to take fluoxetine. Fluoxetine is a once-a-day dose, usually taken in the morning. Remember to take it at the same time every day. If you have trouble remembering to take it, set an alarm to ring at the same time every day to remind yourself. The doctor will adjust the dosage dependent on your conditions. Make sure you keep all appointments to review your condition. Fluoxetine takes 2 to 6 weeks to work, so be patient. Do not give up and keep taking it at the same time every day until the effects kicks in. Before the real effect kicks in, you may experience some minor side effects like nausea, headache, diarrhea, trouble sleeping, or feeling tired or weak. If it's minor side effects, just push through. The minor side effects should go away within 1 to 2 weeks. Tell your doctor if the side effects is severe and does not go away. If you do not start to feel better after 4 weeks, check with your doctor. Once you're stable on fluoxetine, do not stop abruptly. When you're ready, the doctor will come up with a plan to slowly wean you off the medication. If you stop abruptly, you may experience withdrawal effects like nightmares and zapping sensation. Fluoxetine is generally well tolerated and most people do not experience the side effects. Occasionally, symptoms may get worse during the first 1 or 2 months of the treatment until the full antidepressant effects of the medication kicks in. This is more likely to occur in young adults under 25 years of age. If you have someone around you, let them know that you are on fluoxetine and ask them to keep an eye on yourself. If you experience any worsening of the condition, becoming more depressed, more aggressive or angry, wanting to self-harm or having suicidal thoughts, you, your family or carer needs to call the doctor immediately, or you go see the doctor immediately. If the doctor is not available, go to the emergency department of the hospital. It is crucial for you and your doctor to work closely to achieve beneficial results. Side effects. Contact your doctor immediately if you experience any of the following: being sick, vomiting, sudden fever, feeling sleepy, having heart problems, having lung problems, having seizures, or you tip the other way around when you feel excessive enthusiasm or excitement, or you feel restless or agitated. If you experience serotonin syndrome, the symptoms include feeling confused, restless, heavy sweating, shaking, shivering, hallucination, muscle rigidity, sudden jerks in your muscles, diarrhea or a fast heartbeat, chest pains or pressure or shortness of breath, severe dizziness or passing out, painful erection that lasts longer than 4 hours. This may happen even when you are not having sex. Any bleeding that is very bad or that you cannot stop, such as cuts or nosebleeds that don't stop within 10 minutes. If you have an anaphylactic allergic reaction where you experience itching of the skin, skin rash, hives, shortness of breath, wheezing or trouble breathing, swelling of the face, lips, tongue, or other parts of the body, send yourself immediately to the emergency department of the hospital. One very important thing to take note: antidepressants act as a crutch to help you overcome things a little easier. While you're on antidepressants, it's crucial that you apply self-help. Listen to motivational speakers on topics of depression, how to treat yourself better, how to better your life. Talk to your doctor about psychotherapy, go for counseling session, and do meditations. Work towards changing your thinking pattern, changing the way you communicate with yourself, so when you're off it, you are able to stand on your own. Now, if you haven't already answered my question, comment down below what is a better question to ask yourself. 1. Why am I always depressed? 2. How can I be happy? Remember, the quality of the question you ask yourself is going to determine the quality of your mental health. Let me know also in the comments below if making a series of videos and helping changing your mindset would help. I hope this is of value to you. If it is, please give me a thumbs up, subscribe, and turn on the notification button. It's your pharmacist Sunki here. See you around.